American and Pacific Islander Heritage Month. There's obviously so much to celebrate. However, it's also important to shine a light on the work that still needs to be done. Asian Americans experience significant health disparities. So joining us now is Dr. Ming Wu with AdventHealth Littleton. Dr. Wu, thank you so much for joining us. We appreciate it. It's good seeing you. So Asian Americans are the only U.S. ethnic group that cancer is the leading cause of death. Why is that?
So there's actually a lot of reasons why why cancer is still the leading cause of death. There's cultural barriers, language barriers, screening barriers, and all of them contribute to kind of form this issue that's been going on.
Yeah. What are the other barriers, if there's any?
So genetically, for example, there are Asians that are more predisposed to certain kinds of cancers. Additionally, there are screenings that aren't done that should be done in Asian Americans. For example, hepatitis B runs fairly endemic in certain Asian countries, and that can lead to liver cancer. However, that's not something we think about here in America, and so we don't screen for that. Same thing with a bacteria called Helicobacter pylori. It can infect the stomach, can cause stomach ulcers, and later on can cause stomach cancer. That is also endemic in certain parts of the world, including Asian countries, and that as well is not really screened for or looked at, and that can lead to cancers later on if it's not treated.
Yeah. So we talked about some of the barriers when it comes to that. What about representation when it comes to healthcare? Is that also considered a barrier, you think?
So that's an interesting question. So if you look at Asians in terms of like being physicians, healthcare practitioners, they're actually overrepresented. Okay. And that leads to something called the model minority myth. The idea is that Asians have been able to integrate so well into society, in American society, that they're actually considered a model minority. However, because of that, they are treated as Americans when it goes to screening and things of that nature. And because of that, again, things that should be done for Asian Americans aren't done because they're considered just part of the American culture and not specifically looked at as Asian, but just American in general.
Wow, very interesting. Yeah, that's another topic we can talk about. Asian Americans also have the lowest cancer screening rate. So how can we get the message across to get screened for cancer?
Sure, and that's a great question. The answer is education. Discussing it with, having your primary care provider talk to you about, screening, why it's important, what are the reasons for doing so. Additionally, language is a big barrier here. Asian American, if you look at that phrase, it actually encompasses over 20 different countries and over 200 dialects. And so, getting a translator that can speak the dialect to really understand and convey the message is important. And that can sometimes be a challenge.
Yeah, it can be a challenge. We only have a few seconds left. So I'm from a Filipino household. Diet and food are very important. But what about diet in terms of cancer prevention, right? So should we change things when it comes to our diets?
Yeah, one of the biggest things is, I don't know about Filipino exactly, but like, for example, Korean and Asian cuisines, there's a lot of salted, a lot of cured foods. That can actually also contribute to higher cancer rates. And so you want to make sure that you're not, you're eating certain foods that are healthier, fresh cooked, things like that.
Yeah, absolutely. Dr. Wu, it's always good seeing you. We appreciate you coming here.
Yeah, thank you for having me.
Of course, and thank you. You can watch all of our interviews, by the way, on our website, cbscolorado.com. We'll be right back.